look a bit younger, and probably also they want something that is safe and that isn't going to cost the earth, that isn't invasive, and that most people probably would love to end up having the results of a facelift, but do want to go through, the risks of it and the downtime of it,
Patrick has decided the first part of Ellen's makeover will be the Polaris laser lift. Polaris is a laser which combines radiofrequency energy with pulsed light. A topical anaesthesia cream is applied to the skin an hour before treatment to minimise any discomfort. Then, while the laser is moved across the skin, cool air is sprayed to counteract any heat generated by the beam. The laser works by faking an assault on the lower layers of the skin, which, in its defence, produces a new configuration of collagen and elastin cells. These cells rise to the surface of the skin in a matter of weeks, smoothing out fine lines and wrinkles while reducing redness and brown blotches. Join us next time for the second part of Ellen's makeover, when she will be having a series of dermal fillers to smooth out those lines and wrinkles.
Now, if you want to knock 'em dead this Christmas, or indeed if you're prepared.
The first part of Ellen Haggerty's Christmas makeover was a Polaris laser lift. To help with lines and wrinkles, she is going to try a dermal filler called Restylane.
The problem that we're going to attempt to rectify here is the lines in Ellen's upper lip. So Ellen, if you just kiss again for a moment, so we can see that there's 3 to 4 on either side, and that's, fairly normal.
A synthetic form of hyaluronic acid, a substance found in the body. This is used to plump out lines and wrinkles in certain areas of the face to great effect. Dr Treacy has decided to treat Ellen's lip and chin area, as well as the nose to lip region, which is one of the first places we notice sagging as we age. So, Ellen, you're finished?
Yes.
Yeah, you had Polaris and you had Restylane injections. How did that feel?
The Polaris was bearable, but not very pleasant. The injections, no, that was bearable.
Well, you had some local anaesthetic cream put on first, so that must have helped with any discomfort.
Yeah, but you could still feel when it went onto your bone in the Polaris, you could feel a sort of an electric shock. Yeah.
I think what we're going to do tomorrow is Ellen's sort of concerned about little sort of volume loss that she has here in her face. Now, there is a particular compound that we put in here. It's almost like a prosthesis. It's almost like a little implant that we can put in to restore the patient's volume. Certainly, she doesn't need very much, and I can certainly restore a little bit of volume here. And again, this will be a slightly painful technique because the facial nerve runs very close to here, and as a consequence we don't tend to do a regional block of anesthesia. We don't tend to shut down the whole face because it's preferable the patient has some feeling during the procedure.
Well, Ellen, I tell you, you are going to look astonishing at the end of this. I'm really jealous myself. Guys, thank you very much for today.
Okay, not at all. Thank you all.
Thank you.